Just ahead on American Black Journal, how is COVID-19 impacting the census count in Michigan's most diverse and largest county? I'll get the latest from Wayne County Executive Warren Evans, plus a look at how the pandemic and violent racist acts are taking a huge toll on the mental health of African Americans. Don't go away. American Black Journal starts now.
From Delta Faucets to Behr Paint, Masco Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. Masco, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson. Long before the COVID-19 pandemic took over the headlines, the US Census count was expected to be one of the biggest stories of 2020. Now the coronavirus is disrupting the constitutionally mandated count. Here in Michigan, Wayne County Executive Warren Evans held a virtual town hall to talk about the importance of the census. I spoke with him about what's at stake and how the pandemic is impacting the count. It's great to see you, even under these circumstances, but let's talk about what those circumstances look like in Wayne County, the largest county here in the state of Michigan, and the home of Detroit, the largest city that has had a disproportionate effect and consequence as a result of COVID.
Yeah, it's been devastating to the county, as I think most people know. The city has its own health department, so we provide the health services for the other 42 communities in Wayne County. And the numbers have been staggering, as everyone knows, and the death count has been significant. And even in a number of out-county communities, many of them kind of loaded with nursing homes. And that has, been one of the hotspot areas. But by and large, I'm happy with people's response when we started to get our arms around, this in terms of working very hard at testing and working very, very hard at getting people to appreciate social distancing and those sorts of things. And at least until Memorial Day, we were doing a pretty good job. I'm not so sure what it's going to be in 10 days from now, but certainly the numbers in Wayne County have been trending down. And it was so bad that I catch myself sometimes saying, these numbers look great, but the numbers have 3 or 4 or 5 deaths. Not one death is great. Right. So you kind of see the world differently, but we're plugging away at it.
Yeah, this is still a census year, and I am always nervous in a census year about getting folks to fill it out so that we can count everybody and get the money that we deserve because of that. This, of course, makes that more complicated, I think, just because if for no other reason than people are distracted. But the county is still working with other governments to try to really push to get those numbers up. I saw something recently that we're at like 43% or 48% in the city of Detroit. That's not good. We've got to get that number higher.
Better in some suburban areas, but the number is extremely low, and I think you're absolutely right. People are distracted. We've been working on the census for almost a year, so you couldn't anticipate this happening. But the bright side of this is people are home and confined, and if they would focus for 10 minutes, you could fill out the form, online, a number of ways. People need to really understand that the revenue that these communities will get over the next 10 years is in large part dictated by being counted in the census. And so besides the fears that I think some people have about how the information would be used, hopefully that's been dispelled, that is not really an issue. The issue is, think about what services you'd like to see enhanced, and what are the shortfalls in services that you've seen through this pandemic that ought to help everybody think about, we need every penny we can get during this next 10-year period. So, and the undercount is quite often young people. I mean, everybody. I mean, as you said, 45% or so in the city of Detroit's atrocious, and it's not much better in some other places. And we're working hard at that. But, it's young people, 1 to 5, are quite often missed in the count. And I don't think, what's a 1-year-old or 5-year-old? I mean, think about it. This is for 10 years. That kid will be 15 at the end. And, school lunch programs and a number of other things will be affected all of the time that young person is growing up. So people need to really focus on being counted. It's our tax dollars that come back. I mean, this is not pie in the sky or money from heaven. This is our tax dollars that we need to be more than a donor state. We need to get our fair share of revenue back.
Yeah. Let's also talk about the budget impact of all of this. The city is in very bad shape and worried that casino revenue, for instance, won't return, which is a huge part of keeping the city's budget balanced. The state has a projected deficit that I mean, the number is just staggering. Counties have to be in the same kind of condition, I would imagine.
Yeah, I mean, big revenue losses. Obviously, property tax collection when people are unemployed and those sorts of things are an issue. I made the decision kind of based on Wayne County's past history when I took office and that employees had given significantly. And in anticipation of a budget shortfall, I was not about to lay people off at the time. That might have been fiscally prudent, but it absolutely wasn't people prudent, with respect to having the pandemic and then having employment-related issues. So, we ran up a pretty good significant deficit in that area, and then losing revenue from parking at the airport and a number of other places. Ridership at the airport, been down over 90% for the last month, and so tremendous revenue loss. But on the bright side, thank God, we're sitting there with a rainy day fund of $140 million, and the county's running in a way that it was not 6 years ago or 5 years ago. So we'll get through it, but it is tough. But it also makes the point that being fiscally prudent is important. You can't anticipate when these things are going to happen, but you have to be ready to deal with them reasonably. And I commend our staff and the other county electeds for working through this well.
Yeah. I also wonder what you make of when we eventually get to a space where we're on the other side of all of this, some of the things that we might need to do differently going forward, particularly in government. As you said, Wayne County's better prepared for the revenue shortfalls than it was before, and probably better prepared than a lot of other governments. But I also imagine that there's going to be some things that we just are not going to be able to do, and maybe some things we don't want to do. And one of them I always come back to is the tax foreclosure process here in the city of Detroit, which of course has led to a lot of blighted homes and bad neighborhoods and people displaced. It's on hiatus right now, and so is the auction. Is that something we ought to think about? Well, if we can do without it in an emergency, can we do without it permanently?
I think it's something that we do have to think about. I mean, you have some fundamental issues that'll be exacerbated now with unemployment, people losing their house, especially moderate and poor income people. That's the largest investment they have in this world. Mm-hmm. and it's the last investment that people need to lose. Many similarities to, the issue of water. I mean, you have the argument, well, nothing in life is free, and on the other hand, human beings need water. Mm-hmm. And so it helps to show all of the inequities that we have in the system that really need to be worked on when this is over. And I don't mean worked on with a blue ribbon committee who comes up with a bunch of recommendations that you stick under the couch. I mean people who sit there and say, this can't happen again. The disparities in healthcare that we see all of the time. And if you think back about it, I mean, I can think back about it. Just healthcare issues where there are predispositions in the healthcare community that I think some healthcare professionals don't even realize are racist. Right. Black women have a higher tolerance for pain, so they don't need the same level of pain. I mean, that's an example of myths that are accepted. People of color will complain more in the hospital, so you don't have to worry about those complaints. Like someone can tell what complaint is legitimate and what one isn't, and like people don't complain generally. So they're just so many things that we look at the healthcare disparities and understand that if you don't fix those inequities, then every time something like this occurs, there will be a disproportionate number of deaths of people of color. And that's not something that we can afford to tolerate. And I just hope that when this dies down, the fire will burn in people to say, let's make sure this doesn't happen again.
We've seen how COVID-19 is disproportionately impacting Black and Brown people in the number of cases and deaths. On top of the grief and stress, we're also dealing with the news of violent racist acts and excessive police force against African Americans. George Floyd was unarmed when a Minneapolis police officer knelt on his neck until he couldn't breathe. And in Georgia, Ahmaud Arbery was jogging when he was gunned down by two white men. All of this is taking a huge toll on the mental health of African Americans. I spoke with University of Michigan Assistant Professor Riana Anderson about stress and trauma during the pandemic. So these are tough times for everybody, but I tend to think they are particularly tough and tough in a peculiar way for African Americans. It's not just the public health crisis that we're facing, but that layers on top of lots of other things that were already going on. And we keep getting reminded, I think, of the ongoing struggles we have with crisis in the Black community and the toll that takes on individuals. I saw a friend of mine on Twitter post something the other day that said, "Dear white people, your Black friends are exhausted." I thought it was a really poignant way to put what's going on right now.
Absolutely. I think it was so interesting the first few weeks of quarantine where you almost saw this uniformity, this care across everyone of like, wow, we this collective we are really going through a challenging time. And then the news articles started coming out about the inequality that we see in transmission, mortality, treatment, et cetera. That in and of itself was challenging. Then you saw the behavioral finger pointing of whose fault it was for even contracting this type of thing. So that added to it. Then Detroit being a hotspot added to it. And then the things that the Black community is already used to facing now emerges on top of this. So exhaustion, I don't know if there's a more heightened word for that, but exhaustion on 12 is probably where we are.
Yeah. One of the things that struck me about the last week in particular, and I'm talking now about the incident in Central Park, yes, and the murder of George Floyd in Minneapolis, was the reaction of the other people who were involved in those incidents, and that they seemed heightened by the pandemic as well, that the level of frustration that people are feeling, the level of desperation they're feeling, I think also adds to the danger that African Americans face when they interact with other people. I mean, that woman in Central Park seems overly and disproportionately exercised about whatever the confrontation was between them and the police officer. in Minnesota, the look on his face as he put his knee on Mr. Floyd's neck and had almost no reaction as he begged for his life. That's another level of callousness and danger, again, that I think we're facing right now.
Yeah, I'm thinking about these principles around if there are limited amounts of resources, right? So people tend to say that we can all reach some sort of communal goal, knowing that there are plentiful resources, no one's going to be impacted. But as soon as you say there's a cap to the amount of resources, then people start to act in their own best interest. They tend to these in-group kind of, I'm going to have resources for me and mine. I don't know about you and yours, but we're going to be okay over here. So I can only connect that to what you just said, because as people are seeing the toilet paper go off shelves, or they're seeing the limited amounts of tests that are out there, it's that communalism, that uniformity that we had at the beginning is really dissipating. And it's like, listen, we over here, we're going to be good. What y'all are doing, y'all are bringing, disease, you're bringing death, you're bringing these things on yourself, you're bringing threat onto me and my folks. We're not having it. That unfortunately is a bit of what I'm thinking about as you're talking.
Yeah. So let's talk about mental health during this time, and what some of the things are that you can do to maintain your mental health as all of these things go on around you, and in so many cases affect us personally and deeply as these things kind of go on.
Yeah, Stephen. So I certainly think acknowledging that these things are happening is important, and knowing the balance and the limit of how much you're going to intake. So I work with children in particular, and there are so many studies that are starting to come out from some of my colleagues that are indicating any instance of watching these types of videos, in the case of George Floyd, are triggering, traumatizing to our children, even in a vicarious manner. So no, it didn't happen to our kiddos themselves, but just by watching these things, we're seeing anxiety and depression increase in our kids. So again, acknowledging, yes, young one, this is happening in our world. I'm going to ask you to put that phone down. I'm going to ask you not to watch it again, because it can really disrupt your mental wellness. And that's not something I want for you. So having those really frank, open, candid conversations with our youth, but really limiting the amount of exposure that they're getting, I am sure that we can extend that to us as adults as well. I personally am someone who can acknowledge it. I write about it all the time. I think about it all the time. And when I see it, it hits me, it slaps me across the face, it stops my work for the day. And again, on the one hand, it's important for me to feel that, to know I'm still being impacted by it, that those things have not become a norm for me. And at the other, if it's starting to disrupt my wellness, my flow, then that's not something that we want either, because psychological functioning is all about how can I do the things that I enjoy or need to get done. So if we're not able to do those things, it's time to cut off the TV. It's time to go outside and start to enjoy the non-raining weather. It's time to, take advantage of some of the things that we do have available to us. Even though technology on the one hand can bring some challenges, it has a bevy of opportunities of connection between people. It has opportunities of mindfulness, Instagram chat at 12, all these things that allow us to break from the things that are coming at us, that give us some space from that, can really be useful for us.
Yeah. When you talk about that withdrawal, though, long term, of course, what we really need to be doing is engaging a little more with some of these things. And it's difficult, I think, to think about the ways in which we can engage with some of these subjects and maintain our sanity, if not our mental health. I mean, there really are, I think, right now, outsized threats to just holding it together. And of course, any solutions that we might want to come up with for these things really require us to engage. And I find myself right now unable in a lot of cases to do that, unwilling to do it, but I know I've got to go back to it. And then the question is, what does that look like?
Yeah, and I think just in this moment, it's important to acknowledge that's okay, right? Like what you just said and where you are in this moment is okay. We don't all need to be on 10 for everything all the time. It takes a communal effort. It takes people at different stages, doing different things. So some of the work that goes on in my lab and in my program of research is how do we have Black families have the talk, which is something that we have been doing for generations, right? So that when children or youth are put in situations where unfortunately people are seeing them stereotypically or they're being threatened, they can pull from this resource of, it's not me, it's you, number one. There's an entire community supporting me. I know laws, I know regulations, rules. I'm not cowering to you. I'm not saying that, yes, whatever it is that you want, because that doesn't work either, right? So I know what's happening. I know what I want to do, and I've practiced it enough so that when I'm doing it in this instance, I feel assertive, I feel psychologically well, I feel efficacious to take on whatever this thing is. Even if the outcome isn't exactly what I hoped, the process of me dealing with it is really what we think about as psychologists in my work. That taps on to what goes on in later adolescence when folks are going out on protests by themselves, perhaps, or with their friends. What goes on in adulthood when we're able to advocate, write letters, do the things that we need to do that map onto our skill sets, what we have the opportunity to do, all with this acknowledgement and skill set of, I'm not going to be taken advantage of in this moment. I know what I want. I know what's best for myself. Even if the outcome doesn't map onto that, I have to be psychologically assertive enough to say, not today. It's not happening today.
That is going to do it for us this week. You can check out more interviews at AmericanBlackJournal.org. And as always, connect with us on Facebook and on Twitter. We're going to leave you with an encore performance by cellist Cameron Williams from the Sphinx Organization. Stay safe, and we'll see you next time.
From Delta faucets to Behr paint, Masco Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. Masco, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Etzel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.